I've been in the privileged position of meeting all of the leaders featured in this series of films early on in my own work. One directly influenced a change in my management career and got me involved in a national improvement role in the late 1990s. I worked with others as part of the NHS Modernisation Agency and the international initiative Pursuing Perfection. And all of these leaders have influenced my thinking, my knowledge and skills, and my learning. They are all, in their different ways, people who have inspired my own improvement journey. So it was wonderful to reconnect with each person as we filmed for this series. Some of their stories I knew in detail, others I was less familiar with, but each story reminded me of how pioneering these early leaders of improvement were at a time when quality improvement was a niche activity in healthcare, and methods we use commonly today were largely unknown. Their stories brought home to me the rich legacy and learning they, along with many others, can provide us with in continuing our collective journey of improving the quality and safety of care in the NHS. The people we filmed came into improvement in a variety of ways. Mike Richards and Peter Wilcock through their respective clinical work, Angela Pedder through a high-profile crisis in a service, Joe Bibby and Peter Homer through encounters with others already using improvement approaches, John Oldham and Helen Bevan through doing MBAs, and David Fillingham from his work in the manufacturing industry before he joined the NHS. All of them saw and exploited clear opportunities to explore new approaches and to start doing things differently. Although their journeys began in different ways and each of them has held different types of roles in their careers, I've been struck by how many similarities there are between these early pioneers of improvement in terms of their key insights, their motivation, and the lessons they've learned along the way. Keeping the needs of patients at the heart of improvement efforts is a common thread, both as a key motivation and as a way of doing the work. Part of Peter Wilcock's legacy is the development of discovery interviews, which enable staff to gain new insights from patients' own stories about their illness. Joe and Angela reflect on the importance of having patients involved from the start in the Pursuing Perfection initiative, asking what outcomes matter to them, framing improvement goals as promises to patients, and involving them as partners on projects. And after experiencing the sustained changes that came from the Healthy Communities Collaborative, John Oldham says he wouldn't now start any improvement work without citizens also being round the table. Embedding improvement so that it becomes core business for the organisation has been a major preoccupation for the three chief executives we filmed. Each talked about the key ingredient of giving staff real ownership over solving problems and making rapid changes to improve frontline care. This required not just the development of improvement skills and capability for significant numbers of staff, but also the alignment of business and management processes, including at board level, to make new ways of working systematic and part of the fabric of the organisation. The shifting role of senior leadership in the context of improvement was another key theme that came up. David and Joe described the task for leaders in working on the system and creating a supportive environment that enables those at the sharp end to improve care. Peter Homer emphasises the importance of being a role model, encouraging and nurturing staff, but also setting the expectation that leaders of all levels in the organisation need to work on improving services, not just maintaining them. Angela describes the role as being a facilitator, orchestrating the bringing together of ideas from patients and staff with data and methods. A standout message from everyone is that collaboration is core to improving any system. Peter Wilcock highlights the myth of the lone hero innovator. Peter Homer, Helen and David needed to engage huge numbers of staff in the task of re-engineering whole hospitals. Mike and John emphasised that they had to build a movement for change and get thousands of people working in the same direction to make the improvements achieved through the National Primary Care and Cancer Collaboratives. And Joe and Angela talk about the need to work across organisational boundaries to tackle whole system problems. In the Pursuing Perfection initiative, this meant chief executives developing strong relationships of trust and being prepared to cede their authority in order to do what was right for the local population rather than just their individual organisation. And as we move into an era where improving the quality and safety of care becomes core business in the NHS, it feels really important to heed cautions from some of these early leaders of improvement that QI is not a panacea. Jo, Helen and Angela all emphasise the importance of seeking out and using other approaches alongside core improvement methods, such as community organising and human-centred design, or the more technical skills needed to build safer clinical systems of care. A resounding message from each of these leaders is that real sustainable improvement is a long-term game. There may be quick wins along the way, but there are no shortcuts. Improving the system requires constant attention. David, Jo and Peter Wilcock all talk about the need to invest significantly in building skills and capability, but not just among the current workforce, but also investing in the future and building improvement into clinical and undergraduate training. Helen and Angela reflect that the journey of improvement can sometimes feel like taking 2 steps back for every step forward, as we bring along new people who haven't yet been exposed to the same learning. But although there isn't an endpoint and the path often seems to loop back on itself, we're now building on 20 years of experience and beginning to shift the horizon of what's possible. All the leaders we filmed have been involved in improvement work for at least 15 years, many for much longer. I asked each of them what keeps them motivated and resilient during the inevitable dark and challenging times on their journeys. Their answers are all very similar. Keeping focused on making care and outcomes better for patients, connecting with colleagues who share the same passion, seeing skilled and empowered staff make improvements happen have all been sources of energy and inspiration. These leaders were equally clear about the need to take care of themselves and find sources of support and well-being that work for them. For some of them, that means spending time with family or connecting with new ideas and people through social media. For others, working with a coach or focusing on their values has helped them navigate through difficult times. For others, it's taking time out to run marathons, hike in mountains, or go scuba diving, which is much more up my street. A final characteristic that struck me as common among these leaders is their focus on learning. They show relentless curiosity, seek out new ideas and approaches, are willing to learn from their own mistakes, and are prepared to challenge what is often taken as a given. Each person recalled key people, data, stories, and methods that had brought new awareness, insights, and learning to their work. They all see themselves as constant learners as much as improvers. Fostering curiosity in ourselves and in others, asking and listening to patients, families and staff, encouraging challenge, questioning and inquiry are all key elements of creating the culture of continuous improvement and learning the NHS aspires to. There are a multitude of opportunities available to learn and gain inspiration for our own work. For me, listening to the experiences and insights of these 8 pioneering leaders of improvement is a great place to start.